Hey there, and welcome back. All right, so last week we were talking about saying goodbye. When is it time to say goodbye? How do we know when it's time to say goodbye? Um, Touched base on what it's like to say goodbye. And this week I'm going to be covering the kind of like I call them markers that we use here. I use at Woody's place to determine when it's time to say goodbye to one of our senior German Shepherd residents. So what I'm not talking about is when we have a resident who immediately becomes gravely ill, like with bloat. So I've talked about this before that we typically don't put our residents through the bloat surgery anymore because we haven't had a good success rate, and it's very expensive and it's very hard for older dogs to to go through that surgery and to thrive afterwards. And there have been several times where the underlying cause was actually cancer. So we don't do that anymore. So I'm not talking about like when one of our residents here, we get up one morning, everything's great, and then we start to get into our day, and then one of our residents here bloats, and it's like that. It's immediate, and we have to say goodbye. I'm not talking about that. What I'm covering here is when we have a resident like Brandy. I'll use Brandy as an example. She just celebrated her 15th birthday, so of course she is not lighting the world on fire. She's not quite as energetic and vivacious as she was when she first arrived here in 2018. Um, so, so basically, we have this resident who starts to slip away. Sort of their light starts to dim. Time has their way with them, like it does all of us. And they're just not quite as great as they used to be. Great, for lack of better words. But I think you know what I mean. So we're going to use her as an example. And the markers that may be used to identify when it's time to say goodbye to one resident may not be the same for another resident. So some of the markers I use, the biggest one that I use is mobility. Okay, so we're having trouble right now with Sheriff. Sheriff came to us not in great shape. Unfortunately, he's only been here for a little over 2 months, and he was in bad shape when he got here. It is not degenerative myelopathy, but he does have something going on neurologically where he'll be walking and his front legs flip over, like not just the knuckles, the whole leg flips over, and he face dives on the ground, and then he stiffens up, he falls to his side, and he can't get up, and then unfortunately he becomes aggressive when I try to help him. So he's in a lot of pain, and the mobility is a problem. It's a problem. So I will use mobility as a marker or a good indicator on, listen, are we getting near the end here that it's time to say goodbye? Now, we have some dogs who are DM dogs, and of course they have mobility issues, right? I mean, they need to help them up harness, and they're trying to get up. They can get their front end up, but they really can't get their back end up. But once you help them get up, they're up. Okay. And then as the disease progresses, you have to help them up, and you kind of have to hold them because their back end kind of sways from side to side, right? Or they can lean against you and still maintain, the upright position. Then as more time progresses, they need you to hold them like the whole time. They need you to hold their back end like you are their back end. I kind of equate it to one of those giant fire trucks that needs a driver in the front end and in the back, and you're the one driving the back end, and they can drive their own front end. But then once you get them in their wheelchair, if you have a canine wheelchair, they're great. You can zoom all over the place. In fact, some of them zoom so much they flip themselves over in their wheelchairs. So there's that. So mobility. Okay, if they can still go, great. Oh, there's a little rabbit outside my window here. If they can go with some assistance, that's good. Okay, if they really can't go with on their own free will or with assistance from you and or a wheelchair, then it may be time. Okay, so that is one marker that I will use. Now, getting back to Brandy, she's still getting up. She can get up on her own accord. Brandy is a smaller German Shepherd. She was 66 pounds when she came in here, and she's probably like 58 now. She has definitely lost weight. But she can get up on her own accord. Her back end does dip, they're supposed to kind of be like this, and her back end dips. The more she stands, the more it starts to drop. Okay, but she can get herself back up again. The other thing is her back end does sway a little bit. It's not degenerative myelopathy. It's because, she has muscle atrophy in the back end. Her front end, she has elbow dysplasia, so that gives her a little bit of trouble, but she is still doing it. She's still doing it. On most days, not all days, she will walk the sanctuary grounds with us twice. No more than that, but twice. And it's slow. It's very, very slow. Like if it takes us, 20 minutes to get around the sanctuary when we take our big walk, it takes us longer if Brandy's with us because she gets disoriented and it just takes her a while, and it's okay. She crab walks, she has had episodes of vestibular syndrome. Some people call that old dog syndrome, and it's sort of equivalent to like vertigo in people. Looks like she had a stroke, but I don't really think she did. So she walks like her front end is kind of off this way and her back end is kind of off that way. It doesn't look pretty, but she can do it. She can do it on her own. It just takes her longer. It's like us. I mean, I'm in my 50s. Am I as agile as I was in my 20s? No. And I probably won't be as agile in my 70s as I am now in my 50s. So it takes time. It just takes time, and we have to slow down, and that's okay. But that is not an indicator that it's time to say goodbye simply because she's struggling to, keep up with the pack at their pace. We just have to adjust and do things at her pace when she's out with us, and that's totally fine. Totally fine. So not an indicator to say goodbye. When I'm talking about Brandy, all right? Okay. So mobility. That's a big indicator for me. When they simply can't do it anymore, when they don't really seem to have the desire to do it anymore. These are good markers that, you may want to consider, saying goodbye in the near future. Another thing I want to say here is I typically don't use one marker. I go with 3. I like 3. 3 is a magic number. Some people go with 2. For some people, it's 1. For some people, if they get to the point where their older German Shepherd or their old dog starts defecating in the house or having, accidents in the house, that's enough for them. And they're just like, that's it. Time to go. Time to say goodbye. Been nice knowing you. And I don't agree with that. I don't agree with that at all. But I get it. For some people, that is a marker, and to each his own. But for me, that's not a marker. Again, I go back to degenerative myelopathy, and I've worked with old dogs for a long time now. And some of them have accidents. Some of them can't make it to the door because their sensation starts to get obscured. By the time their brain says to them, you got to pee, it's time to pee, they're pee walking to the door. They're trying to get there as quick as they can, but it's happening. It's already happening. That is not an indicator in and of itself for me that it's time to say goodbye. It's a red flag. It is something that says to me I need to step up and take notice. Like, when has this started happen? When did this start happening? How often is this happening? Are they making it outside more than they're peeing inside, or are they just kind of getting up and standing there and just peeing? So that could be a marker, and it's a red flag for me until we get to the point, like I said, where they are literally just like peeing right where they lay or pooping right where they lay. And I'm not talking about degenerative myelopathy. Or they can't make it to the door. No matter how close they are to the door, they just can't make it. So that's something for me too. The bottom line is, when they start doing that, when they start peeing inside or right on their bed where they're laying, or defecating, and you're just constantly having to clean that up and keep them clean. Again, it starts out as a red flag, but then it becomes a marker. All right. So mobility, defecating, or peeing inside. Now, when I said, and I'm not talking about degenerative myelopathy, because degenerative myelopathy is a bit different. It really is. They lose sensation sooner than just because of age. It is a natural part of the progression of that disease as they become more paralyzed in the back end. And, that's again, for some people, that may be the breaking point for them, where they finally say, I'm going to say goodbye. But for me, someone who has dealt with DM quite a bit, I recognize that it's part of the disease, but it's not, in and of itself a deciding factor for me. I am a different breed. I have a lot of patience and a lot of tolerance. And I've been told, I should have been a nurse, because stuff like that doesn't bother me. Until we get to a point where it's like, okay, this is like all they're doing. This isn't good at all. Their quality of life is definitely affected now. Like maybe they have urine burns on their body, or their back end is just becoming matted with poo because they've been laying in it, and you're not aware of it. So until we get to that point, I don't mind cleaning up pee and poop, because they don't realize it's happening. Okay, so I hope I'm making that clear. It's okay to a certain degree, but once it gets to a certain point where that's all that's happening, then it should become, in my mind, a marker that, yeah, their quality of life has really slipped away now. All right, eating. Eating is another good marker. And we're there again with Sheriff, where he's not wanting to eat. Like, he doesn't want to eat all of his food. I think he's eating his food because the other dogs are around and he maybe doesn't want them to get that, but he'll eat some, but he's not eating all. So that's something to keep an eye on. And again, it's like the mobility, and it's like urinating and defecating in the house. Okay. You start to notice it, like, I just gave them their favorite food, and they only took a couple bites and just kind of walked away and left it there. Or they're eating this day, but they're not eating that day, and that's becoming more and more of a commonplace. Or they just don't seem interested, like the interest just isn't there to eat. I got them their favorite treats, right? Maybe cut up a hot dog, like half a hot dog, and cut it up into pieces and let them have it as a treat. But they only took one or two and just really didn't seem to want to bother with the rest. That's an indicator. That's a marker for me. And again, it can start out as something I need to pay attention to. Then it becomes a red flag. Then it's, this is a concern. They're losing weight. There's no interest, little to no interest. And this is a problem now. And listen, folks, you can take your older German Shepherd to the vet. Be like, he's not eating. I don't know what's happening here. I've changed up his food. I'm cooking for him. I'm giving him special treats that he used to love, and he just doesn't seem to be interested. And their blood work could come back great. You can get blood work done and their blood work can come back fine. Like all the markers are within normal limits, and they could still have something going on that you're not quite aware of. I like to get chemistry panels done too, because they, give a better idea of what's going on. Maybe some x-rays may need to be taken, or MRIs or something like that, because cancer can be there. And cancers, there's a lot of dogs who have cancer that don't have an appetite. And we have had it where we've gone and had blood work done on dogs, and their blood work is normal, and they're deceased a couple months later because here they had cancer and we didn't know it. The other thing is pain. If they have arthritis or any sort of dysplasia, hip dysplasia or elbow dysplasia, maybe they have a disc problem, like invertebrated disc disease that you're not quite aware of. Pain will definitely diminish their appetite. Even if you're getting them treated with some sort of pain management treatment, whether that be medications, CBD oils, green-lipped mussel, golden paste, hydrotherapy, acupuncture, light therapy. I mean, there's all kinds of stuff. Even if you have like some sort of pain management system in place, it can still affect their appetite. Medications alone can affect their appetite. If you have them on like a tramadol or something along those lines, could definitely affect their appetite. So appetite is a good marker to use, right? So we have mobility. We have sorry about that. A little bit of an unexpected guess there. So we have mobility as a good marker. If they're urinating or defecating in the house frequently and without knowing, that's a good marker. Appetite is also a good marker, right? They're solid markers to use. And the thing is, you have to know your older German Shepherd. You have to know them. You have to know what they were capable of doing to be able to determine like where they're at now. Okay, you have to be mindful of that. And sometimes it's hard because everyday life is taking place, and some of us have young families and we're busy with our kids. Some of us are professionals and working outside the house, and or whatever the reason, maybe you travel some and you're just not seeing this. Like it's hard to see the daylight through the forest sometimes. It really is, because when we're up close and personal with our older German Shepherds, sometimes it's just hard to see these things that are taking place right before us because we're too close to it. All right. And then maybe we even forget sometimes because we're so busy, or we have other things going on. It's like, oh, it just seems like she just peed in the house a couple days ago. Or was that last week? I'm not sure, So what I like to do is I like to keep a journal about what's happening with each dog. And it could be something that you write down in a notebook. It could be something that you keep on an app on your phone, or video recording. Okay, on January, on Tuesday, January 13th, 2023, Brandy had an accident making it to the back door. She seemed to not know that she had to go. She got up, she started walking to the door and was peeing as she was going. So something just like brief like that. And then this way you can go back and look and see, okay, in December, Brandy had 10 accidents inside the house, whether they be urinating or, defecating or whatever. In January, she had 15 accidents inside the house. So, or in December, Sheriff, didn't want to eat his breakfast 2 or 3 days out of the week, and he only ate some of his dinner, 4 days out of the week. So you have that information right in front of you to help you be able to determine, okay, they're slipping away. Their quality of life is just not there anymore, and they're slipping away. And I need to talk with my vet because I'm concerned now that it may be time to say goodbye. All right. And your veterinarian is a good person to rely on for their expertise in this matter. They see it all the time. They can tell you, hey, look, you know, this is happening right now. Your dog's not really getting around too well. Your dog's having accidents in the house. Your dog's not eating regularly. Your dog is facing the corner and has no idea where he or she is, you know, so many hours out of the day. She can't hear, she can't see, and this is not going to get any better. This is not going to get any better, and you may want to consider that the time to say goodbye is here. So your veterinarian is a very good person to rely on. If you have multiple family members in the same household, it's a good idea to powwow and speak with everybody and say, you know, we need to talk about this. Daisy seems to be struggling. Not only is she defecating in the house regularly and not eating, she's up pacing all night long, and then she's sleeping all day. And when she is up and pacing, she gets herself stuck in the corner, and she's looking in the corner, or she's getting stuck behind a door and doesn't know how to back up to get herself out. So these are all things that you may want to consider when it's time to say goodbye. Now, if you're someone who lives by yourself with your older dogs, then again, I would suggest that you keep that journal, and you have regular contact with your veterinarian. Okay, this is not something that, oh, I was just there last year and now this is happening with Daisy now. First of all, they should be seen like every 6 months when they become seniors, and it's good to have a veterinarian who is familiar with your dog. So if you're at a practice where there's several veterinarians in that practice, it's really a good idea to just have one of them and not all of them. So your dog, so this veterinarian has a good rapport with your dog and knows your dog and can help you determine, okay, you have a little more time. Here are some suggestions you could use to help, like maybe gain weight. I mean, we have a good recipe for weight gain treats for seniors. They're high caloric and they're yummy and they're tasty and all this other stuff. So your vet may recommend something like that. May recommend blood work or some other diagnostic testing to rule things out. At the end of the day, if everything checks out, great. But your senior is still not doing well, okay, because again, they're slipping away. Again, that's who you want to speak with. You want to make sure that you can have an honest conversation with your veterinarian who knows your dog well and can help you guide you down that very emotional road of okay, it's time to say goodbye and we need to set this up. All right. So, and you can have your own markers, obviously. I'm thinking, okay, toys. Maybe your senior loves to play with toys, a ball, stuffed animal, or whatever, and they lose interest in that. Rides in the car. Maybe your dog has always loved to go for a ride in the car, but maybe they just don't seem to be quite as interested, or you finally get them in the car, which may be a struggle because they can't make it in themselves, and they're just kind of whining and whimpering the whole time that they're in the car because they're uncomfortable or just unsure, or something along those lines. So these and more, you have to determine what markers are good for you. But like I said, the ones I like here at the sanctuary are mobility, defecating in the house, diet, appetite. They're all good ones for me, and just like an overall zest for life. Sometimes you could just look at them and see that they're not really happy anymore. They just don't have it anymore. They don't want to, move on any further. And that's tough. It's tough to see, but, we're all going to get there at some point. And I know that this conversation, this whole topic is hard for some pet parents, whether it be an older German Shepherd, a younger dog, a cat, a guinea pig, a horse, whatever. It is a hard conversation to have. It's hard to think about, but it is part of being a responsible pet parent. And it is a conversation that you need to have with yourself. And these markers that I'm talking about should kind of be planned out in advance. Like, I wouldn't wait till your older dog is older and starts to slide down that path to it's time to say goodbye. I would have these in place, maybe when they're around middle age, and this way, okay, this is what I'm looking for. I'm looking for A, B, C. How many times a day are they doing it? How often during the week is it happening? And then take it from there. So they're my suggestions. Pick 3 markers. If it's 2 for you, that's fine. I wouldn't do any more than 3. All right, because then it gets a little jumbly there. And again, for some people it's 1, and there's no right or wrong here. It has to be what's best for you, your dog, and your family. And all things considered, it's better to say goodbye a day too soon than a day too late. All right. I know there's always that question there. Oh, they just had a great day. Oh my gosh, look at that. We've had like so many bad days, and all of a sudden you go and you make that appointment to say goodbye, and they have a great day. And then you start doubting yourself. You're like, oh crap, is this really what I should be doing? Maybe I should wait. Here's the thing, because we've had that happen. We've had that happen. Here's the thing. They may have one good day, but they don't have too many good days after that. All right. So it's really better to say goodbye a day too soon, make it the best day of their life, give them everything they possibly could want, and then say goodbye and be with them when you're saying goodbye. Don't just take your dog to the vet and let someone else walk your dog into that back room and you just get in your car and go. Don't do that. I mean, I know somebody who did that. Just don't. It's terrible. It's shitty. There. Sorry for the language. It really is. That dog needs you. Whether they are senile or not, they need you. They need to smell you. They need to feel your presence. You are the biggest source of comfort for them, and they're scared or unsettled. They don't know what's happening. I swear they do, actually. But you need to be there as a source of comfort for them. So please, it's one of the hardest things that we end up doing, a lot of us. And we need to just suck it up, put on our big girl or big boy pants and go in there and be with our best friend, our best fur friend. And if we cannot do that, I would implore you not to get a dog then. Don't get a pet if you can't do that, because that is part of being a responsible pet parent. All right, so that is all I have for you for this week. In the comments section. Now, first of all, I would love for people to leave a review for this podcast. Give us a thumbs up, whatever, share it. That would be great. But I would love to hear some of your markers that you have used in the past to help determine when it's time to say goodbye. So if you want to comment on social media, when we post this on social media, that's fine. If you want to message us privately, that's fine. If I'm going to put this on YouTube as well, so if you want to comment on there, that's fine. But I would love to hear some of your markers, what you use to determine, hey, we've had a good long life with our best fur friend, but it's time to help them across the rainbow bridge. Okay? All right. So I hope this helps. I hope this helps, because this is by far the number one question I get asked. Me, Dawn, running the sanctuary. It's the number one question. I get emailed. I get stopped when I'm out in public, and when people want to talk with me. It always comes up. It always comes up. So I really, really hope this helps.